I'm Jeff Gardere.
And I'm Dwight Bain.
Recently, the Food and Drug Administration, after several suicides of young people, ordered that all antidepressants carry black box warnings that they increase the risk of suicidal thinking and behavior in children who take them. And Dwight, of course, the natural question is, why did it take the FDA so long to finally come out with this ruling?
Why did it take so long? What kind of a question is that, Jeff? Think about it. The Food and Drug Administration has a responsibility to hundreds of millions of people. That's why the medical care in the United States is the best medical care in the entire world. It took so long because it took so long.
Well, while it took so long, innocent children were dying and families were being destroyed. And if our medical system is as great as it should be, then it should look at the mistakes. What was going on? Why is it that the pharmaceuticals, for example, were holding back information from their trials that could have helped these parents, warn them about the possible suicidal risks? You answer that, my friend.
You make this sound like some kind of a worldwide epidemic. Tragedy is a terrible thing, but look at it. Medical care involves a risk. When you take anything, there's potential side effects. And stop thinking like a liberal and blaming, big dollars instead of looking at all the responsibility. Teachers have a responsibility, parents have a responsibility, and ultimately each of us have some responsible choices to make, Jeff.
Absolutely, but I want to look at our physicians who also have responsibility. If they were doing their jobs and perhaps were not in the pockets of the pharmaceuticals, then we wouldn't need the FDA. I'm Jeff Gardere.
And I'm Dwight Bain. This is Culture Shock.